Good morning and welcome to the Celebrate podcast. We're live every Tuesday at 11 a.m. on YouTube and on Facebook. We want to always thank Elio with Fiesta Media. You got to do your little noise there. Come on, Elio, for producing our podcast. There you go. You can also listen anywhere you listen to podcasts. We've got that uploaded every week, and so you can listen to past ones as well. Today, we are super excited to have with us Dr. Bert Hughes. He's a dentist here in town.
How are you all doing?
Thanks for coming on.
Oh, it's a pleasure.
Yeah. So remind us the name of your practice?
So it's Family and Cosmetic Dentistry.
Okay.
We established that actually in 1999.
Okay.
Actually, yeah. But I've been practicing for a little bit over 30 years.
Dating yourself.
Yeah.
You don't look like you're old enough to be practicing for 30 years.
I was the Doogie Howser of my class.
There you go. Yep.
That's perfect.
I love it. That's good.
So you went to school here in Gainesville. Where are you from originally?
Originally from Los Angeles.
Okay.
And we moved to Jacksonville. Didn't know what Jacksonville was at the time, but my father was retired and my mother helped actually integrate the South as far as the Treasury Department was concerned.
Ooh, that's awesome.
That was a fun experience.
What did she do? That sounds
she was
amazing.
a Treasury agent.
Okay.
For our favorite.
In Jacksonville?
Yes.
Okay.
Yeah. So.
Nice. Did you go to high school in Jacksonville?
I did. I went to Wolfson High School.
All right.
And played tennis there. And
I didn't know you played tennis.
I did.
Well, you've been hiding it. I know you play golf, but what the heck?
Yeah. It was exciting because, the Gator men won the national championship. And
that's awesome.
I remember watching the coach, Brian, we were close to the same age, but I remember watching him playing Wimbledon.
Oh, that's awesome.
Day, so.
That's awesome. Did you play tennis here at UF?
I did not.
No, okay.
Nope. It's called organic chemistry, biology, physics.
Got it.
That dentist focus, right?
Yeah. Did you always know that you wanted to be a dentist?
I did.
Yeah.
It's like 8th grade, and some people, they lay in bed and they read a book to go to sleep. And I used to look at the DAT book.
Oh, my goodness.
A nerd.
That's awesome. Anybody else in the family in medicine or dentistry?
My brother is an oral surgeon.
Okay.
Or oral maxillofacial surgeon, I should say. He, actually, when he was a senior in dental school, I was a freshman. So that's been great. He's back in Los Angeles. He's 4 years older.
Did he go here as well?
He did. He went,
so cool.
He went here for undergrad dental, and then did his residency in LA and stayed out there. But
Cool.
He puts people's faces back together and stuff.
It is amazing what they do.
That is awesome.
Yeah. So you graduated in Jacksonville. You came for undergrad here.
Correct.
And then
and dental school.
And dental
Correct.
school. Okay.
Yeah.
So ever leave back out of Gainesville, or did you just stay after school?
No, I stayed after school. I actually did a lot of research after dental school, and I was working part-time doing clinical practice, and then finally just took the dive.
Let go of the research side. Yeah. And you have a lot of passions for taking care of the needy. And tell us more about what you do with that.
So our office is pretty much a full service. We see anyone. We do have a mission to try to help alleviate some of the access to care needs within our community. So we do see children covered under the Medicaid program, but we see pretty much everyone, private pay and stuff. I always tell a story. I have a patient that's a multimillionaire, and he used to fly a private jet to come see me and take a limo over. And at the same time, I was seeing a child under the Medicaid program. So, it's fun to be able to do both.
Absolutely.
I wish more dentists would do that. So.
Yeah, that's awesome. And you do travel dentistry stuff?
Not travel dentistry. I'm really involved in the Dental Association.
Okay, all right, tell us about that.
I'm the president of the National Dental Association Foundation, and their mission is to help the underserved. We give out a lot of scholarships. I think throughout my tenure, we've done about $3.9 million worth of scholarships, and
awesome. That's great.
We just completed a major research project on sugar-sweetened beverages and their effect in the minority community in adolescence. So that's been really good. I think we just had our 3rd publication come out just last week.
That's awesome.
And we do some community service things as well that we support. And then I sit on the board of the Florida Dental Association, and I'm a delegate to Florida. I just came back from the American Dental Association meeting. So
it was rough in Las Vegas, right?
I was trying not to say where that was.
Oh my goodness.
Oh, you got a lot of education. It was good.
Yeah, it's really important. there's some very difficult issues out there right now. On the surface, they may seem very easy. One of them is a dental benefit from Medicare, and so we're looking at things like that and trying to find the best solution for the American public.
Yeah, that's good.
Yeah, a lot of dentists have gone away from any dental insurance just because it doesn't actually provide much coverage for people.
Correct. It's it's open enrollment right now,
Yeah.
and a lot of people are confused by the plans. I try to break it down to make it real simple. To first help a person understand it's not really insurance; it's a dental benefit plan. If you think about your car insurance, they'll ask you what type of car you drive, how old you are, what's your driving record. But when you go purchase a dental benefit plan, they don't even ask you if you have teeth. So that sort of helps you, right
Give
away.
you a
understand,
guidline on what they're actually doing.
what's going on. So
Yeah.
so really, these plans are designed. They have very low benefit thresholds, usually $1,000 to $1,500. There's some that are more. But those numbers haven't changed in some 20 to 30 years. So, before, you had $1,000 worth of coverage that went somewhere, but now that really doesn't.
Yeah.
And then the way they have it set up, you have to spend a lot of money even to reach that maximum. So what we did is something similar to what you all have. We have a membership plan within our office. There's a number of dentists that are starting these in town where it provides discounts and it rivals that of insurance. It's not insurance, but it's a membership plan.
Yeah.
But it works especially for patients that are on recall or just coming in for their cleanings. And then every now and then may have an issue that they need taken care of.
But it's catching it early and it's consistent and all those things. Yeah.
And the patients like it, the dentist likes it. It cuts out, basically every dental office that takes any type of plan is paying an employee just to go get
to manage
money.
it, to try to figure out how to get paid.
Yes.
Well, we had that in primary care too. It's why we did what we did. Yeah.
So you solo? Are you on your own?
I am on my own.
You're on your own.
Which is fun.
Yeah.
But when you go away for a week, it gets a little bit, it's a little tougher.
Yeah.
My hygienists, they work when I'm not there, but
Yeah.
it's not the same.
Yeah.
But I've been doing it for quite some time.
And you've been in the same location since 99?
99, I moved my office there, yeah.
Okay. So, almost 22 years. I guess it is 22 years, which is crazy.
I know, it's hard to believe.
Don't say that out loud. That sounds like a long time.
It's weird. I know. I just saw something that was like, we're closer to, 81 was closer to 30 than we are to, 19. I was
Well,
like,
we were
what?
born in the late 1900s. I'm
I
like,
know.
why is that in a textbook?
So
What's really
strange.
great is I have, so this year as another one of my students, it's like there's students that either I've given, scholarships through the Dental Association or I've mentored and they're opening up their own practices right now.
So
And
cool.
It's just fun to watch that. I always say it's not, being a leader is not about you and what you do. It's really about who the people
How you
leave
impact.
behind.
Yeah.
Yeah,
And
so
you do a
that's-
lot of that. That's good.
So that's the part I like the most.
It is awesome. So, what do you tell people who are afraid? Because I think that's a big thing for people is that they're afraid.
It is. I will say, I don't know if you've ever been to the Smithsonian. It's no longer, the exhibit's not at the Smithsonian anymore. It's actually at the University of Maryland, which was the first dental school in the country. But there was a dental exhibit. And if you go through that exhibit, you pretty much can understand why so many people are afraid of the dentist.
Those tools are scary. I saw that. Yes, it's
Yeah,
very scary.
It's sort of interesting there. And then a lot of people wait until there's a problem before they address it. So then, it becomes a scarier situation.
Yeah.
So we just try to go slow with them and work with them, ease them in kind of thing.
Yeah.
Some people require, medications and things like that. I try not to, go that route. But we do realize some people do need that kind of stuff.
Yeah.
We see a lot of kids in our office, so it's funny because the 3-year-olds are easier to see than the 8-year-olds because
They don't know yet.
They don't know anything about it yet.
Yeah.
But it's and a lot of parents will impart those fears on their children. So we really try to work hard on trying to work with those kids and trying to help
The
the parents
dentist isn't
understand.
scary. The
Yeah.
dentist is here to help kind of stuff. Yeah.
Yeah, I think you're right, though. Prevention is key. And I think so many people even come to us in the primary care setting when they're like in pain.
Right.
And so we're, behind the 8 ball trying to, get something under control.
Correct.
And yeah, it's tough.
It makes your job a lot tougher because you're dealing with 2 different things now. And one of the things I try not to do unless the tooth has to come out. Many people say, hey, just take this tooth out, and it can be saved. And we work really hard on not doing that. I will tell you, a person will make some really bad decisions when they have a
In
toothache.
pain.
Yeah.
Dental pain is the worst.
Yeah.
Yeah, because it changes the structure of the mouth.
Correct.
And then creates another cascade of events that
Correct.
maybe are not, and people don't always get that.
Yeah.
So,
Yeah.
and then like one of the things that we're finding, a lot of patients are out there. The cost of healthcare is not cheap always, and there's a lot of do-it-yourself stuff going on out there, and we're really trying to work hard on educating the public on the woes of some of that, because while it may seem easy, there's some things that can occur that aren't really the best. And one of the things actually we did over the past couple of years has been curbing this opioid epidemic.
Oh, for sure.
And I don't think I've prescribed an opioid in 4 years now.
Yeah.
So that's
Yeah.
great. So.
Yeah. And we don't prescribe it at our office.
Well, and
either.
what's crazy is that all the rules that have changed with the DEA, and people don't always get that, but every single person that's ever asked for any controlled substance, we have to look them up, and they're
Right.
tracked, and people don't realize that.
Right.
And we've encountered a few times where it's like, whoa, wait a minute. So it's scary. It's scary because if something happens, we get blamed.
Correct.
Yep.
And yeah,
No, thank you.
Yeah.
Well, I don't know if you know, like dentistry, especially the oral surgeons, they are under the gun about this because most people get introduced to opioids when they go to get their wisdom teeth out
Right.
as a young person. So we're really working hard in that area to try to curb it. And so
Yeah.
that's just one of the things we've been trying to do.
So what do you do now for management instead of?
Basically, we've been using a cocktail regimen of mixing ibuprofen and acetaminophen, like extra strength Tylenol, basically.
Yeah.
Right.
And mixing it with either Motrin or Advil.
Yeah, yeah.
And that works really well. Apparently, it potentiates as well as morphine.
Oh,
And-
that's good.
And I mean, I've had friends that have had issues, and I say, "Here, try this," and they all call me. It's like, "This is great." you
Yeah.
know?
Yeah.
So
I
it
know.
works.
Sometimes we've had to figure out other options for people, for sure.
Yeah.
In that vein. So, you've been in practice for over 30 years. You're here in Gainesville. You like to play golf.
Yeah, I do.
And
So-
he likes Biloxi.
Yeah. Oh yes. That's
They have a
right.
golf course there.
Yeah. Do you go golfing when you go there?
Never been.
I
there.
didn't think so.
Funny.
Oh,
So
that's
you know.
great.
So we spent some time with you through COVID playing golf
Correct.
for these different.
We won't talk about Lisa's.
Oh,
golfing
it's already been
problems.
talked about. I'm terrible. It's okay. We can just, let it go.
We'll smooth on past that one. So, going back to COVID, your industry, probably more than any other industry, had the greatest challenge, right?
Well, it's interesting that people didn't recognize is I think our dental assistants were probably some of the best equipped people to
Yes.
deal with COVID.
Yeah.
And unfortunately, they weren't leaned on as much as they should have been. This is what they do is infection control, and they're very, very good at it.
Yes.
And so, but our industry was tough because we produce a lot of aerosols, and in the beginning of COVID, we didn't know what we were dealing with.
Yeah.
But we do know it was in the air. And I remember very early on, I had to take a tooth out on a patient, and I remember, the tooth coming out, us putting it on the bracket tray, and there's a piece of bloody gauze there. And I looked at it and I said, I'm not worried about blood anymore right now.
Yeah.
I'm worried about something I can't even see, or
Yeah.
it just was very ominous to be thinking like that.
Yeah.
But we've equipped our office with air scrubbers and some things behind the scenes to make sure our patients are safe and our employees are safe as well.
Yeah. That's good.
Yeah.
Well, we appreciate all that you do and all that you do in the community for sure. It's great that you have that mindset of giving back, and we know that you do, and through different and different ways that you do that with your practice and yourself individually. So yeah, thank you so much. We always, talk about a health tip. So, we're going to throw that.
I was going
one
to say
to
you got plenty for that. Well, I was just wondering, like, if you have seen really with people with COVID not getting their dental exams, and then you think that people's teeth are worse because of it for that year they didn't go.
I would say the biggest issue with COVID that we've been seeing is people are breaking teeth.
Oh,
They're stressed. And so
grinding and stuff like that.
We do know mental health has been a very hot topic lately, but managing your mental health is very important right now. That's probably one of the biggest things. I mean, yes, you have the people who need to get in and get their teeth clean, their gums are bleeding and things like that, but obviously, with some good oral hygiene practice at home, you could help solve that. But that other part, sometimes, I think the mental health counselors have done quite a great job in creating a telehealth system and doing things online. And I would just encourage people to take advantage of that.
That's a good health tip.
that is a good health tip.
I mean, I thought you were going to say flossing or something. I mean, isn't that what you have to preach all the time?
I have my joke on flossing.
What's your joke on flossing? You can't say. Okay, never mind.
Is
it PG?
It's like washing your butt but not paying attention to your crack.
Isn't that a good one? Yes. See, that was a good health tip.
That is a true visual. Like, yeah. Don't forget to floss.
And wash your butt crack.
Oh, boy. Oh, my goodness.
This is a PG.
Yes, it's fine. It's fine.
That was very PG.
I do have one quick question. So, you talked about grinding your teeth and people breaking their teeth off.
Right.
Do you recommend people getting night guards?
I mean, you can do night guards. We've been making some soft night guards, which are less expensive for patients, but it'll also tell us when they're having issues. Also, we ask patients sometimes to keep a little bit of a diary so that they can recognize when they're grinding. I mean, I've had patients that, they start about 3 o'clock in the afternoon, right? As that work day goes on, it all piles up, and about 3 o'clock they get going on it. And then there's others that, do it at night as they're falling asleep or waking up and things like that. Yeah. One of the telltale signs is if you wake up in the morning and you feel like you've been chewing pizza all night, like your jaws are just tired.
Yeah.
That's usually a sign.
Headaches.
And then your partner will tell you because it will wake you up.
Yeah.
It will annoy them.
Yeah.
A little disruption, for sure.
So if you're trying to get your partner away, you just start grinding your teeth. And
do you do the dental appliances for CPAP and stuff like that, or do you send those away?
Haven't been making any of those.
Okay.
But there's a big industry on sleep medicine. Mm-hmm. Just with us seeing so many children, it's just not something that we've gotten into.
But you see everybody. You see a lot of kids, but you see everybody. Yeah. So Naomi and I are actually on your membership plan, and it's been great. And she loved your office, and Paige loved your office, and we appreciate what you do.
Yeah, they're great.
It was good.
Yeah, that's awesome. So how do people find you? I'm sure Elio put that up. Yeah,
he's working on it.
He's working on it.
And I did want to say, with your membership plan, you get quite a discount on like cavities and
it's like 40% off on,
which is amazing
on our restorative as far as just routine fillings and things like that. And another neat thing is as you add family members, it discounts the membership fee for the additional family members.
And I know you said full service, so that includes things like Clear Correct or Invisalign, right?
Yeah, we do aligner therapy. We do fillings on crowns, and we've been doing a lot of implant procedures and things like that.
Nice.
That's the big thing now. Although I would warn the general public about just jumping right into implants sometimes. A lot of people are like, okay, just take all these teeth out and put implants in. It's not always the best thing to do. So there's nothing like your natural teeth.
Sure.
Yeah. So. Well, and then some people have bone loss, and
correct.
There's all kinds of. My mother-in-law had to go through all kinds of things to try to get hers all ready.
That's our issue with like the do-it-yourself orthodontic stuff is that many times there's not appropriate X-ray taken. We've seen some really difficult cases where they're moving teeth and there's impacted teeth under that, and there's just things that you should have a professional
I remember us talking about that one day playing golf. You were talking about the those clear
online
programs. Online, and they aren't they aren't always the best for people.
Right.
And people think, well, I don't have that much to move, but you don't actually realize.
Right.
So it's good to have.
I mean, for you to move one thing, you have to sometimes move something else. So it's a delicate dance. Yeah. I think our orthodontists they just do such a wonderful job, and that's just something that you really should leave.
It's a professional thing.
Yes.
It's not a do it at home, do it yourself kind of situation. Just like taking your teeth out at home.
Yeah.
Yeah, it's not good. Not unless you're a little kid and you want to get the tooth fairy money. Then
correct.
It's a line there. But anyway.
Hey, the tooth fairy is doing $5 now. So
I think some of them are going up.
10, 20.
Inflation. It's inflation.
It's inflation.
That's crazy.
Yeah, I've heard like if you have to go to the dentist to have one taken out, that's worth 20. I'm like, man, if only as when we were kids, that would have been nice.
I know.
That'd
Start a
been awesome.
401k on teeth.
I know. It would have. Yeah. I mean, my daughter Naomi was the one to take hers out. She was wiggling them because she wanted money. So it's pretty funny.
Awesome.
But anyway, well, thanks for being on with us.
Oh yeah, it's been my pleasure. I think y'all are wonderful. Obviously, I have some of my staff members and myself are on your plan. It's just one of the greatest things. So
yeah,
so
we
thanks
love what we do.
for
So
really
thank you.
promoting that.
Yeah.
Thank you.
Thanks a lot.
thank
We
you.
appreciate it.
Appreciate you being here.
All right, guys, we will see you next week at 11 live on YouTube and Facebook. Again, thanks, Elio. And if you want to listen to previous podcast, anywhere you listen to podcast, you can download previous episodes. So thanks a lot and have a fantastic week. See you next week.
Bye.
Thank you.